Hello, my name is Dr. Ayitharappa. I'm one of the students doing Diploma Diabetes from Cardiff University. Today I'll be talking about diabetes and its complications, particularly macrovascular complications. As we all know, diabetes, it's a chronic condition due to high blood sugar level. This high blood sugar level could be because of complete lack of insulin secretion from a gland called pancreas, or insufficient secretion of insulin, or our body being inefficient to use this insulin. Looking at the prevalence of the numbers, 108 million people were suffering from diabetes in 1980, which has increased to 422 million people in 2014. This has been predicted to increase further in 2030. The prevalence of diabetes is increasing in middle and low socioeconomic countries. Diabetes is a major cause of death due to heart attack, stroke, peripheral vascular disease, and it also causes blindness due to retinopathy. WHO predicts diabetes could be the 7th leading cause of death by 2030. Coming to the complications of diabetes, it's divided into microvascular and macrovascular. The microvascular complications caused by diabetes are neuropathy, retinopathy, and nephropathy when it affects the brain, eyes, and kidneys. Whereas the macrovascular complications are cardiovascular disease, peripheral arterial disease, and strokes. As the name itself says, macrovessel, when it affects the big blood vessels. Insulin resistance, dyslipidemia or increased cholesterol level, high blood sugar or hyperglycemia plays an important role in clogging of the arteries for the formation of atherosclerosis. This narrowing the caliber of the blood vessels results in diminished blood flow to the important organs and manifests as heart attack, stroke, kidney failure, peripheral vascular disease. Many studies reveal there is a strong link between the diabetes and the development of peripheral arterial disease. UKPDS, one of the important study done in diabetes, shown any 1% increase in HbA1c will cause 26% increase in risk of peripheral arterial disease. Insulin resistance itself raises the risk of PAD by 40 to 50%. So, why are these diabetic patients prone for peripheral arterial disease? What is the reason or pathophysiology behind the development of peripheral arterial disease? Because of chronic or persistent increase in blood sugar level, which acts as an inflammation and damages the inner lining of the blood vessel. This damage has been clogged by a bad cholesterol called LDL cholesterol. Try to patch this up and form a fatty deposit. This fatty deposit builds up in the inner lining of the arterial wall, which supplies the legs or heart or whatever but the end organ. This makes them narrower, hindering the blood flow, and can even stop the blood flow to the legs and feet completely. This condition can lead to pain, especially when walking, as well as number of other symptoms like foot wounds that are slow to heal, one foot being much more colder than the other, gangrene, and in severe cases, foot or leg amputation may be needed. So why does diabetes increases the risk for developing peripheral arterial disease? Or what is the etiology for this peripheral arterial disease? Diabetes itself is a major risk factor, and the others are overweight or obesity, physical inactivity, smoking, high blood pressure, high low density cholesterol or bad cholesterol, family history of cardiovascular disease, stroke or peripheral arterial disease, the previous history of coronary artery disease, heart attack, angina, angioplasty or bypass surgery or stroke. So how to prevent or treat this peripheral arterial disease? The treatment for peripheral arterial disease focuses on reducing the symptoms and preventing further progression of the disease. In most cases, lifestyle changes, exercise and claudication medications are enough to slow the progression or even reverse the symptoms of peripheral arterial disease. So looking at the risk factors one by one, the physical activity. Lack of exercise is a major risk factor for development of PAD. Simple walking regimens, leg exercises and treadmill exercise program can ease the symptoms. Exercise for intermittent claudication, which is a poor circulation in the leg arteries due to buildup of the plaques. It's a special program consisting of alternating activity and rest in intervals to build up the amount of time patient can walk before the pain sets in. And this exercise is done in a rehabilitation center on a treadmill and is being monitored. The next important risk factor we identified was diet. Diabetic patients are normally referred to dietitian and they should be in touch with them regularly. The fat content in our body should be less than 30% of total energy intake, and we need to reduce the unsaturated fatty acids and increase monounsaturated fats. Increase our diet with vegetables and fruits and eat fish at least twice a week. The other important risk factor we identified was smoking. Tobacco itself is a major risk factor for the development of PAD, heart attack and stroke. It's strongly advised to stop smoking. Patients are referred to smoking cessation clinics and there are lots of different forms of nicotine replacements available in the market. Further, PAD can be treated by controlling the high blood pressure and also lipid lowering medications. Normally, doctors prefer ACE inhibitors, which is a type of anti-hypertensive medication used to treat diabetes and hypertension. Cholesterol levels. High cholesterol levels can be treated by using simvastatin or atorvastatin, a group of medication which is used to control the cholesterol levels. Other important thing is managing diabetes itself, keeping the blood sugar under control and being in touch with the diabetic nurse or multidisciplinary team who could advise the patient regularly. Furthermore, when the medical management fails, there are some surgical options. There are some minimally invasive surgical treatments like atherectomy or stent placement or angioplasty. When the whole length of the blood vessel is obstructed, this can be treated by doing a bypass surgery where the blood vessel from the other part of the body is taken and connected to the blocked part, and this increases the blood supply to the legs. If peripheral vascular disease is neglected or not treated, it will lead to lots of complications like diabetic foot ulcer, Charcot joint, and calcified peripheral vessels. Strongly advised to follow the guidance given by the doctors. Thank you so much for watching this video.